Dr. Tim Johnson sat down with the president at the White House this afternoon, and Tim is joining us tonight from Washington. Tim?
Charlie, I had 10 minutes with the president, and I began by asking him who would decide what medical care is unnecessary and therefore should not be paid for.
We don't think that we have to impose draconian measures to force patients to use a generic instead of a brand name drug, for example, or to force a hospital to administer one test instead of 5 tests. But if, generally speaking, there's consensus that this will work in most circumstances, then I think most patients and doctors don't want to spend money unnecessarily.
The House bill that came out yesterday proposed a so-called Health Benefits Advisory Committee. 25 people appointed mostly by you, headed by the Surgeon General, who's going to figure out what benefits will get paid for and what won't.
If I've got a panel of doctors and experts whose only motivation is making sure that we get the best bang for the buck from our health care, I think that's a situation that most Americans would feel pretty good about.
I then quoted from some doctors who were very worried about increasing coverage without enough primary care in place.
One of them said, "I fear that the plan will increase insurance coverage without increasing the ability of primary care physicians to take care of everyone who needs care."
What we want to do is to provide a powerful set of incentives for more and more young people who are interested in healthcare, interested in medicine, to go into primary care. So putting in a sizable chunk of money into making life better for primary care physicians, particularly those who are willing to serve in underserved areas, I think we can solve some of those problems.
At this point, the president made a surprising statement about his timetable for solving primary care problems.
We're not going to solve all of them immediately overnight, and that's why I think we have to anticipate this program's not going to start up probably until 2013. That gives us 4 or 5 years to start developing programs to solve this problem.
Obviously, the president has many other problems to solve, but it is also quite clear that currently health care reform is #1 on his to-do list.